Today we're going to discuss something that people do not want to hear about, hemorrhoids. The reality is that hemorrhoids are present in about 50% of adult patients. Hemorrhoids can present as bleeding, burning, or itching. Bleeding that is bright red in color or associated with a BM typically is associated with hemorrhoids. However, if you have any question as to the nature and origin of your bleeding, please speak with your physician. If appropriate, colonoscopy is a very reasonable diagnostic tool to exclude more significant pathology. Hemorrhoids are nothing more than distended blood vessels in the rectum. They're characterized as internal or external hemorrhoids. Hemorrhoids can be treated with either local care, warm baths, suppositories or creams, and perhaps medications prescribed by your doctor. When traditional therapies have failed, there are several minimally invasive procedures that are available nowadays. At Digestive Care in North Broward, we have most recently been using a technique called CRH banding. CRH banding is a very, very simple outpatient modality that allows us to cure about 90 to 95% of patients with both internal as well as external hemorrhoids. The procedure is office-based, requires typically 2 to 3 visits, and essentially has no downtime. Patients will leave the office after the procedure to resume their normal schedule. The device looks basically like a syringe that is inserted into the rectum with the patient fully awake. No preparation is required. The device has a suction device attached to it. As you can see here, pressure is applied to the syringe, sucking up tissue, and then the rubber band is deployed onto the hemorrhoid. This allows the blood supply of the hemorrhoid to dissipate over a period of several days, and eventually the hemorrhoid will disappear. Typically, patients need 2 or 3 sessions to resolve their hemorrhoidal blows. We suggest that anybody who has any rectal bleeding be evaluated by their physician first and not make the presumption that they do have hemorrhoid disease. Thank you for your time.